Hello, my name is Dr. Koheli Bhattacharya and today we are shooting from my home rather than my clinic because we have some construction work going on in the clinic. लेकिन आज का वीडियो होगा about flippers. Now flippers is a very interesting eye exercise and it is also something that we use as ophthalmologists or optometrists or orthoptists to test our eyes. So there are two things. One is for testing and diagnosis and the other is for treatment or some kind of eye exercises. So today's video I'm going to try and cover both of it, but the major part of the video will be about how to do the exercises. इसीलिए मैं जब एक्सरसाइज समझाऊंगी तब मैं हिंदी में बताऊंगी ताकि मेरे सारे ऑल इंडिया के पेशेंट्स समझ पाए कि कैसे करना है ये फ्लिपर का एक्सरसाइज. ठीक है, सो नाउ लेट्स गो इनटू व्हाट इज अ फ्लिपर. Now a flipper has four lenses, two like this and two when you flip it. That is why it's called a flipper, because you can flip it on your eyes. So what happens is that the one side of it will have minus flippers, the bottom ones, and the top ones will have plus number lenses. So plus number lenses, minus number lenses, or minus number lenses and plus number lenses. So what is the use of having a flipper that has both plus and minus number lenses? So the first thing is that you can also check some child or some agitated person's glasses number using a flipper and using multiple flippers in your hand and check the refraction. Checking their glasses number can be done easily using flippers. The second thing is we measure something called accommodation with this. So we have positive reserve or positive accommodation and negative accommodation or negative relative accommodation. So positive relative accommodation is and negative relative accommodation. Let me just explain how that works. Okay, so now first of all your accommodation has to be at rest. What does accommodation at rest mean? That you are wearing your spectacles. First of all, if you have spectacles and your best corrected long distance is perfect, so you wear your spectacles first of all. And the second is you hold the book or the text that you're reading at 45 centimeters. That is your accommodation is at rest. Okay. Now in this thing, if you want to measure how much is your positive accommodative positive relative accommodation, that means how much is the lens inside your eye able to become round like this. How much is the eye able to become a convex lens? How much of it can it become? And to test how much it can become, we test it by using negative lenses. So when we are putting the negative number over our eyes and are able to see clearly, that is how we measure how much is the positive relative accommodation. For normal people, it is around 3.5. So plus 3.5 diopters, which we measure using a flipper of minus 3.5 diopters. If you are an ophthalmologist or an optometrist, you do understand why the minus and the plus need to be like that. But if you don't have to worry if you are a patient, because you are not going to be measuring what is your positive relative accommodation. You can just ask your doctor, how much is my positive relative accommodation? Now, how do we measure negative relative accommodation? For this, the lens inside your eye has to flatten. How much can the lens flatten? So by finding out positive and negative relative accommodation, we are trying to find out how much can the lens flatten and how much can it curve. So your negative relative accommodation is how much can your lens flatten, and this is tested by putting plus lenses in front of the eye. So for putting the plus lenses in front of the eye, the lens inside the eye has to flatten down for the letters to be clear. And generally it is of plus 2 diopters. So we measure it using so it is a minus 2 diopters and we measure it by putting a plus 2 diopter in front of our eyes. Plus 2 diopter flippers. Now can this be measured only by flippers? No, you can use it on a trial lens and we can put the lenses, and that is also one way of measuring your relative accommodation, right? So that was how do we test, how do we use the flippers for testing your eyes. अब चले जाते हैं कि आपके लिए फ्लिपर्स कब काम आएगा और आप फ्लिपर का एक्सरसाइज कब करोगे एंड कैसे करोगे, राइट? तो फ्लिपर का एक्सरसाइज हम उन लोगों को देते हैं जिनको है प्रॉब्लम अकोमोडेटिव फैसिलिटी का. ना अकोमोडेटिव फैसिलिटी क्या होती है? अकोमोडेटिव फैसिलिटी अगर मुझे एक्सप्लेन करना है आपके मोबाइल या मोबाइल के कैमरा या फिर एक डिजिटल या नॉर्मल कैमरा को लेके, तो मैं ऐसे एक्सप्लेन करूंगी कि अगर आप फोटो ले रहे हो इस डिस्टेंस पे और आपने क्लिक किया, बहुत अच्छे फोटोज आ रहे हैं, लेकिन अभी आपको पेड़, ग्रास, हिल स्टेशन का फोटो लेना है, तो जब आप फोन उठाते हो तो देयर इज दिस मोमेंट वेयर एवरीथिंग इज ब्लर, राइट? एंड देन यू हैव टू ईदर टैप ऑन द स्क्रीन फॉर इट टू बिकम क्लियर। समझ में आया ना? So that tapping or adjusting for the distance is called accommodative facility, where you are adjusting yourself for far. And then again आपको पास का फोटो लेना है, आपने दूर का लिया, फिर आपने पास में लिया, and all of a sudden it's all blur again. Then you tap on the screen and then it again comes into focus. So accommodative facility यही होता है कि आप कितनी जल्दी और कितनी फोकस के साथ, कितनी क्लैरिटी के साथ आप दूर का देख सकते हैं, और कितनी जल्दी आप पास का जब देख रहे हैं तो आप क्लियर कैसे कर सकते हैं अपना इमेज और अपना फोकस। सो अकोमोडेटिव फैसिलिटी है कि आप कितनी जल्दी कर सकते हो वो, ठीक है? सो उसे कैसे मेजर करेंगे? आपको एक फ्लिपर मिलेगा विच इज ऑफ -2 and +2. तो जनरली वी स्टार्ट विद -2 and +2 फ्लिपर. तो यू हैव टू होल्ड, वेयर योर स्पेक्टिकल्स. If you have spectacles, hold your book, and this is below 40. Below 40 only people can do these exercises very well. And then you hold your book at 45 centimeters. Then you put your flipper on, and if everything is clear, you say clear and you flip it. Then you, to make it clear, you blink your eyes, blink it, and when everything is clear, then you flip it. And again you blink and you clear the text, and then you flip it. And when everything is again clear, you flip it. When everything is clear, you flip it. ठीक है? So this is called a flipper rock exercise or rocking your flipper exercise. And इसमें how will you count is how many cycles can you complete in 1 minute. Generally you should be able to flip it 10 to 12 times. And how is a cycle counted? When you go from minus to plus back to minus is 1 cycle. Okay, so 2 flips. So you are clear, you flip, and then clear and you flip. That would be 1 cycle. When you have flipped it twice is 1 cycle. So how you can measure कि आप 1 minute का टाइमर लगाओगे, you will hold your book at 40 to 45 distance. Now what should be the size of your text? So generally in the clinic we will be measuring N6 or N8 depending on how clear your vision is. So the first thing is it should be slightly easy, meaning you should be able to flip. It shouldn't be so small text or so big text that you're unable to flip. So find a book which has readable text, which you are quite comfortable reading without wearing your without using the flippers, and then put the flippers, and then you know that you are using your flippers to go from +2 to -2. So you are flipping from +2 to -2. So this is your lens inside your eyes, ठीक है? And when you put the flipper, it has to go to +2, and then it has go to -2, +2 and -2. How smoothly आपके eyes के अंदर का lens can do this kind of stretch and relax, and so this is a kind of exercise for the inside muscles, the ciliary muscles which are inside your eye. समझ में आया ना? So these are the muscles which are inside the eye, which you cannot exercise by looking to the right, looking to the left, and all of that. ठीक है? The other thing is you are going to be doing this exercise monoocularly, meaning you are going to close your eye and do it with only one eye. And you will see that it is easier to do it with one eye, and then you will use the other eye and do it. Okay, so you will find out first of all what is your accommodative facility for right eye, what is your accommodative facility for left eye, and the third is what is your accommodative facility using both the eyes, and then you will write your numbers. Then every day you will do this SRE flipper exercise rows about for maybe 3 minutes or 5 minutes. So you may start with just doing 1 minute exercise per day, then you may move it to 2 minutes, then 3 minutes, maximum about 5 minutes का flipper exercise. अब अगर आप करोगे तो जो muscles है inside the eye, they will be easily moving. ठीक है? Now if you are unable to clear with a +2 and a -2, you can move down to a 1.5, +1.5 and -1.5 flipper or you can move it down to +1 flipper and -1 flipper. So this is the range of flippers जो available है market में. The next thing is you are going to maintain a log कि how many times can you flip in a minute. So maybe in the beginning you could flip only like 2 times, मतलब only 2 cycles you could complete in 1 minute. Then with days you may move to 4 times that you can flip. So your speed has doubled. इससे क्या होगा? Your speed of seeing the blackboard and down has doubled. Earlier you were seeing the blackboard, and once you were seeing the blackboard, when you were seeing the text on your book, you were unable to see anything clearly. And it was taking you time to focus on the teacher, then back in your book. But now by increasing it, now you are able to do it faster. There is more comfort. You don't feel tired. You don't have a headache at the end of school. The second thing is, if you're a sportsman, if you're into sports, then if you've done flippers, you are able to focus for far and near. You are able to catch the ball, focus, and then move your focus on the wicket and be able to hit the wicket. So there is that distance and near ka, you are able to do it much faster, much smoothly. So these are the things. And of course, if you are someone who is in their late 30s and still doesn't have reading glasses, you can use flipper exercises to build this ciliary muscle inside your eye, and you may delay आपका reading glasses की ज़रूरत. So generally after 40 years of age, people need +1 reading glasses. But someone like me who is doing flipper exercises, of course we have to see how it works. I am using -1 and +1, and I'm also using my -2 and +2 flippers every day for just 1 minute exercises, and I want to see if I can delay my need of reading glasses by just doing some amount of flipper exercises. So these are the advantages, these are the uses of flipper exercises. It is very easy to do just by sitting and doing it. You can do it also exercises. Then this is the video to show you how to do it uniocularly and dono eyes ka, then binocularly there is exercises. Also, as I said, it can be used for diagnosis. So it's a very handy tool to have. Now flipper जो है वो हम हमारे iFit kit में नहीं add कर रहे हैं. It is expensive, and so if you want the flipper with the iFit kit, just let our assistant know on 8308309418. That is the number to book your iFit kit, which is our vision therapy kit, which already has 8 to 9 eye exercises. And many of our patients have said कि आप flipper देते हो क्या? Where can you buy a flipper? Then yes, we will add the flipper to your iFit kit, and you can just pay the extra amount and take it. Can you buy the flipper just on its own? Yes, you can. And again, the place to order it would be 8308309418. I hope you have understood कि ये कैसे करना है exercise. If you have any questions, please leave it in the comments below and we will answer it there. Thank you for watching. This is Dr. Koheli Bhattacharya.